the girl generation has changed her name, which I will ask Muteshi to remind me the name that it has changed to. We talk with them and we are saying, take directly to the people, to the implementers on the ground. So I feel that we need to build just the capacity of communities, and our gender officers will be present to give them moral support. They count on their politicians, especially in their votes, and not speaking things that will hurt people. Yeah, you tell people stop circumcision. I know in my area, FGM had really gone down during my tenure. It's unfortunate that when I left the scene in 2013, it has come up until now. It is considered a hotspot. Why? Because the leadership that came after me supports such things. You will find they are buying a goat for those who are in seclusion, or they are sending maybe some canvas or something. They are just giving support without really talking anything about that. So something that is not being implemented. So I think we need to raise our voices more or make more noise, and noise is better made by the civil society organizations. And I'll also still challenge the development partners not to just go to one area, too many NGOs in one area, all development partners in one area. We need to spread out. I think it is better when they report, or the National NGO Coordination Board should also be active in this area to see you have come in, you want to set up, that place is being covered by this and that NGO or supported by this NGO or donor, and can you be able to do the same in another community? So that if I have so many, I would still say, let us implement this in Embu, even if I'm from Marakwet, and we go and look for somebody there, because I've gone to the NGO board and say, we want to do this, and we're saying, I think we have enough players in that area. We need to go on this area. So I really feel there's so much that has to be done to encourage communities to come up and speak for themselves. People need to be told you can actually form faith-based organizations. Can we talk to these chamas which women always have? These days you find women telling you, I'm getting late for this meeting. If I don't reach on time, I will have a penalty of maybe 100 shillings. Now, we need to be able to talk to such community, to talk to them, so that it's not just that they are getting money for economic empowerment. They should be able to talk about, against the detrimental things within their society. So we still need to reach out this information which we have. For example, NGEK is there as a coordinator. NGAO, the national governments, most these are which are found everywhere. The National Council for Children's Services, they're still in the counties. But now you'll find a children's officer might just be seated there because they don't have facilitation and wait for somebody to report this has happened. That's when they'll go to the county commissioner, give me facilitation, or the police. I need to be taken over here. There is a child in danger. Yeah. So now, if we depend on government completely to do the implementation also, we should let them do the monitoring and coordination of activities being done. So we need to be proactive as players ourselves. And I know Migori, I think they're here, they're very, very active also. Yeah. Of course, Mtoto News, I thank you that you're there. Now you need to have branches everywhere, Mtoto News. But sometimes the donor community will say, we'll only operate in this area. But can I say I'm Mtoto News in Migori, but I want to have a branch of Mtoto News in Elgeyo Marakwet County, for example, or in Laikipia. Yeah.
Thank you very much, Honorable Lina. Thank you. And it shed a lot of light on issues of coordination, and also emphasizing on why CSOs should work together towards actually just pursuing it. And I think these points are going to come up in our next session. We have presenters who might need to leave, but now we need to actually fast track our next session, which now talks about the national context on ending child marriage and FGM in Kenyan sectors. So this puts things into perspective. We have 3 presenters in this session. May I call upon, again, Madam Bernadette Loloju. I hope your presentation is ready with the technical team, who's going to come in and talk about the Kenyan National and County Government Initiative on ending FGM. We are trying to give a brief 5 minutes or at most 7 minutes time slots to all the presenters. Madam Bernadette will be followed by Mona Aika of UNICEF, and then Faith Lanoy. Madam Bernadette.
Thank you very much, Mildred. I can see my morning was packed for this. And thank you so much, Honorable JB Kilimo, for your input on issues of coordination. Obviously, coordination is one of the greatest challenges we are facing, not only in government, but also in the NGO sector and other sectors. But what we have done as the Anti-FGM Board is that we have tried as much as possible to make sure that we are implementing our policy, which guides us to have county anti-FGM steering committees in place. And what I can report with confidence is that we have the county anti-FGM steering committees in place, but we are still working on strengthening them and making sure that they work. And under the County Anti-FGM Steering Committee, which is chaired by the County Commissioner and co-chaired by the CEC gender of the county governments, and has in place all the NGOs, CBOs, FBOs, government agencies sitting under this County Anti-FGM Steering Committee, we hope as we continue strengthening this structure, then it will be able to make our work much easier, because we are looking at having the County Anti-FGM Steering Committee, then the Sub-County Anti-FGM Steering Committee, and then the Ward Anti-FGM Steering Committees. At the moment, the county that is leading in this is Kajiado County, that are already setting up their Ward Anti-FGM Steering Committees. And the reason why Kajiado is leading is because Kajiado has already launched their, policy. They already have an FGM policy. It's the first county and the only county as of now that has a policy in place, and it was launched in 2019, immediately after we had launched the national one. So we are looking forward to strengthening and also putting in place the policies for the other counties. So I would just ask our partners at the community level to work along with us and walk with us this journey of making sure that we have strengthened the county anti-FGM steering committees and the sub-county and the ward. So I'm looking at the progress we have made in the campaign to eliminate FGM. And as you are all aware, we have a target of 0 FGM by 2022, which is a very high target that has been given us by the President of the Republic of Kenya. Some of the areas that we have made progress, obviously what has kept us rolling as Kenya is our Constitution 2010, which also we have a number of issues on harmful cultural practices. Then we have the deal breaker, which is the Prohibition of FGM Act that came into place in 2011, and it's the one that brought in on board the Anti-FGM Board, the board that is mandated to coordinate all anti-FGM activities in this country, to create awareness on the negative effects of FGM, to resource mobilize for the campaign to end FGM. And also our role is on policy and strategy, which we have done very well, because now we have in place the Eradication of Female Genital Mutilation Policy 2019 that was launched by His Excellency, the President of Kenya, in November 2019 at State House, Nairobi. We have started implementation of that policy. We have the anti-FGM strategy, the revised strategy that we are implementing 2019 to 2023. That's another very important milestone that we have in the campaign to eliminate FGM. Then we have the costed action plan to eliminate FGM by 2022. This costed action plan has in place a number of objectives that will help us to see how we can move forward this campaign. But I can assure you our greatest challenge in implementing this costed action plan is the resources. But we are trying as much as possible to see how we can work with our partners, our development partners, that includes UNICEF and UNFPA, that have been in the forefront in really supporting us and also supporting some of our partners who are working at community level to make sure that we reach this target of 2022. And we also depend on our stakeholders. We include the CBOs and NGOs at community level. This is not a task that is ahead of us, but I know we will make progress. Even if we are going to make a very small progress, we are getting there. Having the commitment by the president himself has really helped us to make a lot of progress in the last 1 year, even though we have had challenges of the COVID-19 pandemic that has really made us regress a bit in what we had really been moving to make sure that we have by 2022. Number 3 is that we have now a more committed multi-agency team. We have formed a multi-agency team in 2020 October. And this multi-agency team is made up of 10 ministries, departments, and agencies at our level, at national level. So this multi-agency team is made up of the Office of the Director of Public Prosecution, whose work is to prosecute FGM cases. Then we have the Ministry of Interior and Coordination of National Government. As we all know, the Ministry of Interior and Coordination of National Government has structures in place up to the community level. That is up to the sub-chief, assistant chief, and the village elders. So that's a very well coordinated structure by the Ministry of Interior and Coordination of National Government. We have the Ministry of Public Service and Gender, which is mandated also on issues of policy on the area of gender and also FGM. We also have the Ministry of Labor and Social Protection, where we have the children officers sitting under that ministry up to the county level and even sub-county level. In some counties, we even have the the children officers even at sub-county level. This is also another structure that is helping us because of issues of child protection. And FGM is a child protection issue. So it also comes under the Ministry of Labor and Social Protection. Under this multi-agency team, we have the National Treasury, because the National Treasury is supposed to give money for us to implement the presidential directive to end FGM by 2022. And that is their role, but we have had a lot of challenges in terms of getting resources to really carry out this mandate. Then we have the Anti-FGM Board. The Anti-FGM Board is the coordinating structure for all these ministries, departments, and agencies. We have the Ministry of Education. As you are all aware, the Ministry of Education plays a very critical role because in this country, every child is supposed to be in school, and the school is supposed to track the children. They are supposed to track if the children are in school. If they are not in school, then where is this girl or where is this boy? So the Ministry of Education plays a very important role. And we have also worked with the Kenya Institute of Curriculum Development to include FGM content in the school curriculum. So we have FGM issues included in the school curriculum. And that's why the Ministry of Education comes in. So we have the Ministry of Education as one of the ministries that is under the multi-agency technical committee because of the role they play. And even as you already know, those NGOs and CBOs working at community level, you have been going to schools also to have the health clubs, stroke anti-FGM clubs, stroke peer clubs or school clubs, where children are talking to each other about FGM issues. Issues of sexual and reproductive health. So the Ministry of Education comes in as a very important ministry in this multi-agency technical committee. Then we have the Ministry of Health. The Ministry of Health plays a very critical role on issues of policy. We already know that the minister sent out in October a policy statement to all dispensaries, medical facilities in this country, to clearly say that if your facility is used to take a girl through FGM, then you're in trouble. Also, making sure that the nurses and the doctors do not take girls through FGM, what we call medicalization of FGM. I know Dr. Kimani is with us here. At Kenya, we are at around 17 or 18% medicalization of FGM. And we know the counties that are notorious for this: Kisii, Narok, Nairobi, Migori, and even other counties are becoming very notorious, Garissa, on issues of medicalization of FGM, Embu, Tharaka, Meru. And so that's why the Ministry of Health is here, is part of the county, of the multi-agency technical committee, because they need to help us with issues of medicalization and also inclusion of FGM content into the curriculum of learning institutions like the Health Kenya Medical Training College, the University of Nairobi, a University of Moi University, any university that is doing medical, taking either nurses or doctors, because most of these nurses and doctors don't understand what FGM is and how to treat FGM complications, especially during childbirth. So that's why the Ministry of Health is part of this team. Then I don't know if I'm at 10, but I'll continue remembering the other ministries. I don't know how many ministries I'm at.
Actually, Bernadette, I was just about to interrupt so that we can create room for the two other facilitators. Yes. One is supposed to leave, but I would still hold you to your presentation on that one, because right after this we open to plenary, and you can pull in some more. So thank you so much for that overview.
Okay.
The brief overview of exactly just how that works and how the board also coordinates. I know the team is taking notes. And so now, may I just now welcome Mona Aika of UNICEF, who will quickly capture for us, give us an overview of work being carried out by the Global Partnership to End FGM and the Global Partnership to End Child Marriage in the East African region, and regional findings on ending child marriage and FGM. Mona.
Thank you very much. I'm trying to share my screen. I hope you can see it.
Yes, you can see it.
Okay, bear with me.
Great.
Thank you very much. Thank you for that introduction. My name is Mona Aika, and I'm in UNICEF Eastern and Southern Africa Regional Office. I'll be presenting to you today on the various initiatives that are happening at the regional level to address child marriage, but also FGM. I hope you can still see my full screen. Can you confirm that?
Yes, we can still see your full screen.
Wonderful. So I'll start off by quickly mentioning the global figures, and just there, because of, in the interest of time, I'm not going to go into great details. I just want to highlight that, sub-Saharan Africa, which our region, East Africa, is also part of this, is also pretty high in terms of the number of children who are getting married. If we zoom in more, I'm sharing with you the next slide, which is more on a preview of a recent analysis that UNICEF has conducted. And it clearly shows that the region is nearly home to 50 million child brides, with the largest number in Ethiopia, as you can see on the screen there. And the levels of child marriage vary widely in this region. And we see there on the title that this region is home to 2 of the top 10 countries in the world. And the practice of child marriage, as we all know, is slowly declining. And we see much more dramatic reduction of child marriage for the children who are, below the age of 18. Now, in terms of what's happening in the region and globally, we have the UNFPA UNICEF joint programs to end female genital mutilation. And we are currently in the 3rd phase. And this program is there mainly to address issues concerning the girl child, the social norms, and also making sure that there's the legal and policy environment that accommodates the rights of children and prevents FGM. There is also the global program to end child marriage. And this program aims to have a catalytic effect and works with many partners to really address child marriage, to advocate for support, to advocate for practical action to end child marriage, and promote gender equality and the rights of adolescent girls. And again, all these programs, we work with partners, CSOs, the government as the key partner, the custodian, and the owner who drives the various initiatives to address the rights of children, especially the girls, and of course the other UN agencies. I'm presenting here. I am from UNICEF, but we work along as with my other colleagues who are based in UNFPA, and we also work with academia and also the private sector. And then the next program that is there is on the Spotlight Initiative, the EU, the European Union Spotlight Initiative, which has countries implementing the program, but also a regional component of the program. Overall, the child marriage, this program, the Spotlight Initiative, it's being implemented in about 4 countries in this region, and you'll see them very shortly. Then the next point I'd like to highlight, we also have in this region, and being driven by the African Union, a campaign to end child marriage. And this campaign, there's also a strategic plan in which member states are encouraged to raise awareness around ending child marriage and also promote activities that will result in ending child marriage. We also have the African Union Salima initiative. Again, this is an initiative to raise awareness and to promote the girl child and for people to see the girl child as whole. There's no need for cutting. So the Salima initiative is really looking at how the girl child is protected and advocated for. So I'm just showing you the next slide, which is showing the global program on ending child marriage, the abbreviation, and then the UN joint program to end FGM. But also we have the spotlight countries in Africa. So as you can see, the Eastern and Southern Africa, we have countries like Ethiopia, which have both the practices, child marriage and FGM. We have Eritrea, which has the harmful practice of FGM, Mozambique, and child marriage. Uganda has both practices. Somalia, Zambia, as you can see, and the list goes on. In the interest of time, I will not go into greater details, but this will somehow be able also to address the concern that was raised earlier about why do we need to make linkages and address the 2 harmful practices together. And and as it has already been responded to, in countries where they have both practices, it is likely that the practices are happening, one leading to the other. We've had examples from Kenya, but also you have countries like Ethiopia also, which has both the practices, and they tend to have to address the harmful practices holistically, not just address it as an issue-based or a single-based initiative. And then this next slide is showing you the EU Spotlight regional focus. And as you can see, for the Africa region, in which we are all in, the program aims to address sexual gender-based violence, harmful practices, which are both FGM and child marriage, and also sexual reproductive health rights. And you can see the other regions across the world also having a thematic focus to really ensure that we advance the issues of child marriage, but also other violence that are affecting children. Now, if I can zoom into the approaches, or rather the strategies that we're using to address the various harmful practices in the region. I'm very pleased to have had Kenya, interventions, and really, congratulations to the Kenya government and the various partners there who have already implementing the various interventions to advance the rights of the girl child. So in this region, I mentioned earlier, we have, 4 countries, you saw them earlier, that are implementing the global program to end child marriage. And the strategies that are used to tackle child marriage, we use a mix of interventions that appreciate the complex nature of the problem and the social, cultural, and structural factors undermining the practice. So those are the 5 approaches that we are we are using. And in the interest of time, I'm not going to go into greater details, but looking at the first one, this is all about empowerment of adolescent girls and increasing agencies, and most importantly, the resources for the adolescents, especially the girls who are at risk or have already been affected by child marriage. And we're also looking at increasing the investment in girls by shifting social expectations of girls and boys, including engaging women and men. So you see the next one is all about the family, working with families. And then the third one, looking more at the system, something that has been mentioned earlier. We have to ensure that our interventions do not address an issue that is just happening to a certain community, but rather, in order to address this issue, whether it's child marriage or FGM, we need to look at the system overall. So enhancing systems and services that respond to the needs of adolescents at risk of or are affected by child marriage. And this can be done through enhancing legal and development policy frameworks to protect the rights of adolescent girls and boys, developing the legal and policy framework, as I mentioned, also on issues affecting FGM, and also incorporating, making sure that the laws, the policies that are there are also, conversant, also address the issues that certain communities or practices, harmful practices that are ongoing. And somebody also mentioned earlier about the importance of having a multi-sectoral approach. And I was very pleased to hear Kenya, talking about how they're engaging with education, the education ministry, health sector, and various other sectors that are key to advance the rights of the children. And lastly is more about the evidence, making sure that we have the sound research to show us, well, the situation, but also for us to be able to track the progress that we're making. So about this last one, about using and building data and evidence, it's important that we improve the data collection, analysis, and most importantly, the disseminations of reliable and disaggregated data in regional and national and subnational level. So all these levels, we need to have this information. And also these programs are looking at the area of strengthening evidence-based learning and knowledge management. So having such a meeting like what we're having today is extremely important. So in terms of, and this is my last slide, in terms of what have we observed? What have we learned on the ground? And what do we need to do to ensure that ending child marriage and FGM really happens, if it can happen before the 2030, the SDG goals? But, how can we ensure to do this? I want to highlight 4 key areas that are extremely important and already discussed. The first one is looking at supporting and the importance of empowering the girls. And one of the reasons that we have already been mentioned is the area of poverty, which may push families, parents, caretakers to marry off their children, to mutilate them so that they may be ready for marriage. So making sure that the existing social protection programs are also extended to these girls or to the households that who have girls risk of being affected by the harmful practices, whether it's child marriage or FGM. And we're also seeing the importance, the second point, of addressing the norms, the social norms, the gender norms that negatively impact the child, the girl child in particular, to ensure that we have certain interventions continue to address the social norms. And what we're doing at UNICEF with our partners, we're looking at, more importantly, the social norms measurement. How can we ensure that the work that we are doing, the interventions that are being rolled out to address the social norms are actually making the change we want to see on the ground? So there's also ongoing assessment, and the baselines are being collected for the countries that are implementing the global programs, for us to be able to measure moving forward. And the third point, there's a need to also scale up our interventions. We've heard, in a country, you may have a certain community or a province or, subnational level that practices FGM, but the interventions that may focus only on certain number of districts or regions. So there's a need to ensure that we still scale up, we advance the interventions being done, and making sure that the access to reproductive health and protection services especially for the in and out of school adolescent girls, are available. We've all noted how COVID-19 negatively impacted the children, and most importantly, especially those children who do not have access to digital devices. We can all recall back in, from April onwards last year for this region, at the onset of the pandemic, many schools closed across the region, and children, teachers were moved towards online learning. But we very much know not all children were able to follow through because they don't have the connectivity, and many of them do not have the devices. So it's really important to ensure that the reproductive health is extended to all children across the country that need it. And lastly, another important point I want to close with is the importance of looking at the protection system for the prevention and response. I put there more on violence against children at all levels, but most importantly, given that each country has a system for child protection system, so how can we use the existing child protection system in countries where it's available to address the issues? And when it comes to the system, is looking at the enabling environment, the legal and policy framework, the national plan of actions that are costed. And when it comes to the costing, we're now seeing the importance of looking at the public financing for children. How much is the government allocating to these costed plans? And this is also another area that UNICEF is leading to get an analysis of the allocation from the government side when it comes to ending child marriage, and also how much is coming from the development partners and other donors that are available at the country level, really to paint the picture and have an informed advocacy moving forward for the need to increase resources towards all these issues of child marriage and FGM. And this last slide is just showing some of the links, active links, and I hope I will share this with Girls Not Brides so that you can all have a look at what's already exists in this region and also globally. So thank you very much. I'll stop here. Thank you.
Thank you. Thank you very much, Mona Aika. Thank you. Very important presentation there. Thank you for capturing what all of us are looking out for. I mean, it's amazing to look at all the global networks to end both child marriage and FGM, and also now getting into the discussion of how we at the grassroots can actually interact with the rooftops that you've just presented. Absolutely wonderful. We will have time to engage Mona, but because of time, again, we need to have our presenter, Faith Lanoy, come in at this time. Faith Lanoy Mpoke, who is the Girls Not Bride Kenya Coordinator and Plan International. Faith, are you there? We're going to have more time to engage our facilitators. So as you have questions and engagement you want to bring up, just note it down, because then we will open up room for plenary. Is Faith Lanoy here?
Yes, Mildred, thank you very much.
Hi,
I'm just
Faith.
waiting.
Thank you, Faith. Great to see you. We're just trying to keep focus of time, yet we want to gather all those amazing things you want to tell us, but you're welcome. Take it away.
Thank you. So I'll just give a brief presentation of Girls Not Brides Kenya. And as Nerida rightly put it, we are the new kid on the block. And we just became Girls Not Brides Kenya last year in August. So karibu to this presentation of Girls Not Brides Kenya. So next slide, please. Yeah, so Girls Not Brides Kenya was initiated in 2017. We've been in existence since 2017. And we are now officially Girls Not Brides Kenya, an affiliate of Girls Not Brides Global. Our partnership currently has a civil society membership of about 60 organizations, and these organizations are drawn from the national level, county level, and grassroots organizations. So we have faith-based organizations, we have youth-led organizations, and we also have girl-led organizations who are members of this partnership. We work closely with the government and also its agencies as we carry on with our day-to-day activities on ending child marriage in the country. And next slide, please. The reason we decided to form a national partnership is because there was no very good coordination among civil society organizations, and we felt that when we come together, we will be able to work well together, bring our ideas together, and even influence resourcing of child marriage initiatives. So one of our key reasons for coming together was to ensure that we have better coordination as we work on child marriage in the country. We also wanted to ensure that resource mobilization for child marriage initiatives is realized, because most of us in the child marriage field are also working on female genital mutilation. So we felt that if we come together, then we will be able to get resources to also address child marriage as we work on female genital mutilation. This was also a platform for us to share experiences, learn, and have joint advocacy. As you know, we are drawn from different levels, the national, the county level, and even the grassroots. So when we come together, we are able to really share experiences, what is working at the community level, what is not working at the national level, what do we need to do. So this has created a platform for us to really share and learn a lot from each other. We also realized that we need to do evidence-based programming, and I'm happy that all the presenters have talked about data. So we realized that we need to really move looking forward to having data that we can use to program. We know what is the prevalence of child marriage at the counties, what is happening at the global level, what is happening nationally. So with this data, then we are able to come up with interventions that are able to bring about change in the lives of the girls that we are working with. The other reason that really made us to also come together as a partnership is because of the statistics of child marriage in Kenya. And Mona has alluded to this. We are at 23% nationally. And this is still very high compared to when you look at other counties. You will find that, for example, Homa Bay is at 58%, Migori is at 57%, Northeastern is at 56%. So as much as the national prevalence is low, we see that some counties have high prevalences of child marriage. And we felt that this really makes it important for us to come together to see how best we can address child marriage in all the counties that we are working in. We were also not spared by COVID, and this has also been alluded to. And recently, according to the Policy and Strategy Unit study that was shared, we got to know that about 160,000 girls never got back to school because they were married off. So there is really a challenge in the country, and there is need for us to work together to ensure that our girls are protected from child marriage. And we intend to work with other stakeholders in this field to ensure that our girls are protected. In the same report, our boys were also not spared, because you realize that about 25,000 boys also did not go back to school when schools reopened. So there is need for us to have conversations that bring on board everybody to ensure that we are able to protect our girls and even the young boys as we talk about child marriage and even female genital mutilation. Next slide, please. Some of the achievements we have to date, some of the achievements we have to date as a partnership is that we have participated in the Universal Periodic Review process, and some of our proposals were adopted, like we had proposed to have a national action plan to end child marriage. And this is one of them that was accepted, and we hope to work through that to ensure that we achieve this. We have had stakeholder engagements on child marriage and FGM. Most of our members operate at the county level, at the grassroots level, and even in the 22 hotspot counties, FGM hotspot counties. So I'm really happy that we are already working together, utilizing the spaces that are already available, like the anti-FGM steering committees at the county levels. Our members are present in these committees, and we are also able to work together to bring out the issues that are affecting our girls, including child marriage and FGM. We have an existing coordination structure from the national to the grassroots level. We have a structure that ensures that we communicate from the national level to the grassroots level. So we are able to share information, we are able to really coordinate our activities as a partnership, and we are able to come together at some point to even see how best we can work together with other stakeholders to ensure that child marriage is also given the attention it deserves, like female genital mutilation. And I just want to say, like Lina JB rightly put it earlier on, that FGM previously was referred to as a big spoon, but now a spade. And that is where we also want to get to as child marriage crusaders, so that child marriage can also be given that space, the attention it deserves in the country. And in collaboration with Girls Not Brides Global, we have secured funding across to implement a project in Migori County and in Tanzania that is addressing child marriage. And this is just the beginning. We hope to get more opportunities where our community-based organizations will get funding to implement interventions that will bring about change in the lives of our young women and girls. Moving forward, we intend to collaborate with other stakeholders in the development of a national action plan to end child marriage in Kenya. We know there's already a costed action plan to end female genital mutilation. It will also be an opportunity for us to know probably what are the points, at what point can we work together with the anti-FGM board to have a consolidated action plan and not a standalone action plan on child marriage. So that is a conversation that we can have moving forward. And we are also looking towards having the board look at issues of child marriage and FGM together, and not child marriage or not FGM alone. So this has been a discussion we have had since 2017 when the national partnership was initiated, and we hope to take forward this conversation. And this platform has really provided an opportunity for us to start this journey and even see how best we can be able to collaborate, because as we have been saying from the beginning of this conference, FGM and child marriage are interrelated, and working together towards addressing the two will give us more leverage. So that is it from Girls Not Brides Kenya. The last slide, please. And as we always say, next, we always say at Girls Not Brides Kenya, let girls be girls, let girls become women of their dreams. Thank you very much.
Thank you very much, Faith. Thank you. And I am sure this is a presentation that all of us were waiting for, in the sense that we want to understand exactly where Girls Not Bride Kenya, how far it has reached and where it's going and how it looks like. Now, in your programs, it might show that we actually need to break onto an energizer, which we will not. That is the bad news. But the good news is that in 2 seconds, I'm going to ask you to put on your cameras and just rub your hands a little bit. It's getting chillier in Nairobi. Just rub your hands a little bit. I want to see you. Rub your hands a little bit as we come to the next session. Faith, rub your hands. Yeah, just rub your hands a little bit. If you're looking at me, you must see I've taken my old grandmother blanket and put it around myself, because it's really getting a bit chilly, and you can flex your fingers a little bit as I'm flexing. Please try and do that. Put on your cameras. Caroline Langat, if I can see you do it, it really helps. We were actually supposed to just flex them like really hard till you hear a sound. Jenna Nyango, till you hear a sound. Monica, please. Dennis, just rub. Okay, let's rub. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. Claudia, you're actually stressed. Let's go. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. 1, 2, 3, 4, 5, 6, 7, 8. Now, I need you to write down all the points you want to bring across to the presenters who have just passed. Time is trying to be hostile towards us, but we will not allow it. We are here to discuss important issues and how we are going to move forward. That is why we will quickly jump into session 3 on child marriage integration into other sectors, where we are having these presenters sharing emerging issues and trends from regional, national, and subnational levels. So I want to quickly call on a presentation from Pop Council, where child marriage and FGM is happening in Kenya. And this analysis that actually pulls into data will be done by Dennis Matanda. the deputy team leader on the FGM Data Hub, and key investigator on the Evidence to End FGM-C research programs. Welcome, Dennis. Welcome, Dennis.
Thank you very much. If the host can enable me to share my screen.
Yes, please, Total News, if Dennis can share his screen. Are you able to?
Yes, just a moment.
Great.
Yes, I hope you can see my screen.
Yes, we can see your screen, Dennis.
Yeah, thank you very much. I am deep in Migori doing some data collection, so my internet is a little bit shaky, but hopefully I'll be able to finish this. So this is very short presentation which I'm making regards to child marriage and female genital mutilation in Kenya. And the question that I was asked to kind of like highlight was, where is it happening and what are some of the trends that we see? So just to be on the same page, I know most of you maybe are aware, but here we are referring as the way WHO does define what FGM is that practice that involves partial or total removal of the female genitalia or any other injury to the female organs for non-medical reasons. And it goes ahead to categorize the different kind of like types. You have type 1, type 2, type 3, and then up to type 4. So here we are referring to all of them, not necessarily so any form of FGM, be it type 1, type 2, or type 3. So that's what we're referring to when talking about FGM in this context. So in Kenya, I think if you look at the national data, is that, and I agree with, I was listening to earlier presenters really saying that the issue about FGM, we have seen some progress, and data also shows that for sure there's been some progress, though it is also important to mention that this is 2021, and the last DHS that was generated was in 2014. We were hoping that we'll have some new data that can be able to show us really what has happened for the last almost 6-7 years, which is quite a big duration that we need to. But all the same, this is what we have. So we are looking at nationally representative data. And from 1998, though also not that in 1998, data was not collected in Northeastern, I think, and some parts of Rift Valley because of security reasons. So it could have been even higher than 38%. But you see really a steady decline up to 2014, which shows that the efforts that have been put in place have kind of like have helped in terms of reduction. But that is national level. And sometimes when you're talking about this 21% in 2014, what really does it mean? Because the denominator here is all women between the ages of 15 to 49. And we know that FGM doesn't happen in all kind of like communities. It is certain ethnic communities that do practice FGM. There are others who do not. And therefore, a more interesting analysis needs to be done in relation to what are the trends within country. And a good one is to look at the age cohorts. The age cohort kind of like approach is important because it gives you a sense of, if you look at the prevalence among the older women and the younger ones, do you see any change with time? Because here you're looking at generations going back almost 30 years. Those ones who are born way back and they were able to kind of experience FGM. So if you look at this, I just picked these few ethnic communities because they traditionally have practiced FGM. Of course, there are others, but just because the graph, if we put so many of them, then you won't be able to see the picture. But I picked this because of the history that we have. And you can see clearly that if you look at the older women, there's been some trend in terms of like reduction of FGM. If you compare the older cohorts and the younger cohorts using the 2014 data. So you see the Kikuyus, you see the Meru, you see also the Kalenjin, you see some drop, significant drop in terms of FGM, though I think also another disclaimer here is about the term Kalenjin, which kind of like brings together so many other communities and lumps them together. So that's also another caveat. But you also see another picture up there of the Maasai, or some little bit of drop, but the prevalence is also still quite high. You see also the Kisis, it's somehow dropping, but also still high. And then you also see the Somali ethnic community where there's just no change, even if you look at the different age cohorts. And then another analysis that we did, which is to me very important, because when you're talking about women of reproductive age 15 to 49 years, this you're combining women who experienced FGM sometimes long time ago, and it might not give you a picture of what has been the effect of the most recent interventions in terms of reduction of FGM, and that you can only get if you look at the daughters. So parents cutting their daughters. And DHS does indeed give us some data on girls aged between 0 to 14. The challenge has always been that if you consider that age group, then there's a possibility that a girl is 0 and or a girl is 2 years, 3 years, but you're saying she's not cut, but she's still at risk of being cut. And therefore, if you use certain statistical kind of like analysis, in this case, we use the Bayesian geoadditive kind of like modeling, it's possible, and survival analysis, it's possible to control for that and give you some estimates around girls by looking at the neighborhood kind of like concepts. People who counties that are closer to each other are likely to be the same than those ones that are far apart. So we did those kind of like analysis, and you can be able to see that the progression, that there are certain counties where you see progress in relation to young girls being cut, and you see other counties where really there's just no change and it's still red. And in this case, you see that FGM kind of like declined in most of the counties. You see changes, but you still have those hotspot kind of like counties like Mandera, Wajir, Garissa. You see Marsabit, Isiolo there. And then also in this other side, you see Kisii and Nyamira really being hotspot areas where FGM among these young girls is happening. I'll now turn my attention to child marriage, and here we are referring to any formal or informal union between a child under the age of 18 and an adult or another child. That's how UNICEF does define what we mean by child marriage. And in computing that indicator of child marriage, we look at the percentage of women in the age group between 20 to 24 year old who are married or in a union before they are 18 years old. The reason why we focus on that 20 to 24 is because of the biasness. Either the child, maybe they're not married, but may end up being married, and therefore we try to focus on the 20 to 24 to give proper kind of like estimates. So nationally, we see here I use the 2014 the Kenya Demographic and Health Survey. Again, it would be nice to get the most recent because of the many years, but this is what we have at a national level. So we are about 12% when you're talking about girls aged between 15 to 19 years who are currently kind of married. When that survey was conducted, we are at 12%. Then you also have women 20 married before age of 15. So that is about 4%. Then you also have women aged between 20-24, but married before the age of 18. And that's what people kind of like refer mostly, which is the 23%. These are important because it shows you if you have a county where you have very many who are married even before the age of 15, then of course that even changes the type of intervention that you want to do in terms of reduction of these cases. So I'll focus now at the county level. Another disclaimer here is that the DHS is not powered at county level. So some of these estimates have very wide confidence intervals because of sample size, but it's good enough to give you a sense of some of the counties where we see they're kind of like hotspot areas in relation to child marriage. So I'll begin with the indicator on girls aged 15 to 19 who are currently married. And you see the red one in between there is the national prevalence. And I put it there just because I want to see you have certain counties which are almost even double what you see at the national level, which is something to worry about. And you see counties like Samburu quite very high up there, Wajir 21, 22, 30 and 30 Samburu, Tana River, Mandera, Wajir, Isiolo, Migori, Kwale, Bomet, Turkana, Marsabit, Kilifi, West Pokot, and so on. So these are counties that the prevalence is higher than the national level. You also look at that indicator on those who are married before the age of 15, which is even more serious, you know. So prevalence here you also see in Garissa, also higher than the national one. Tana River also coming up, Migori, Isiolo, Turkana, and Samburu. So you see this, you can see some consistency when you're looking at these counties in relation to issues also about FGM and also issues about child marriage. And then what we all know when you're referring to the 23% at the national level, that is those ones married before age of 18. And again, here you see certain counties, quite a number of counties really having very high prevalence if you compare that in reference to the national level. Tana River really leading again, Turkana, Isiolo, Wajir, Migori, Samburu, Narok, Homa Bay, Mandera, Garissa, and so on. So I was just highlighted this to show the picture. And this is important because then it gives you, if you know the hotspots, it gives you a chance to be able to look at where do you want to implement, where should you focus, and what is exactly happening in those areas. So in summary, I think there's been some progress, as has been mentioned before, especially in relation to FGM. Child marriage is not so much. But I think it's important that we use data, as you say, in terms of informing some of our interventions. And there are certain counties where really you need to look at them with a close eye. And FGM, of course, there are those northeastern bordering Somalia and Ethiopia. And also you have Kisii and Nyamira, you know. And then also child marriage, you also have these other specific counties where you need to focus. About just mention about some of the correlates or drivers that you see. I didn't include that in this presentation, but people asked about relations between child marriage and FGM. The truth of the matter is that if you look at some of the drivers of these practices, they're almost the same. If you do some regression, you see issues about education. So girls being born of mothers with low education, they are at a high risk as compared to those ones with high education. Issues about poverty, you know, the wealth index, you know, it still shows up. Issues about beliefs. So women who believe that FGM should continue, they are likely to cut their daughters. So some of these drivers are kind of like structural, and therefore the issue about multi-sectoral approach still applies. So I'll stop there. Thank you very much.
Thank you. Thank you, Dennis. Thank you, Dennis. And those statistics, the data, extremely important, because we know that what cannot be counted cannot be accounted for. And so I think it's important for all of us to take note. But just before we open up to everybody to just have a discussion, and I'm happy that everybody is still following, may I just kindly welcome Arwin Fine. Arwin Fine, the Senior Data Evidence and Policy Officer at Girls Not Brides, still on data because the numbers matter. The numbers matter. And Irene wants to present findings from lead review, overview of challenges and opportunities. Irene, you're welcome. Please take the stage.
Hi, everyone. Can you hear me okay?
Yes, we can. Thank you.
And can you see my screen?
Yes.
Fantastic. Let me just enlarge. So first of all, thank you very much to all the previous speakers and for inviting me to speak. It's been a very interesting morning so far, and I've definitely learned a lot. So I'm going to talk a little bit about trends in prevalence for both FGM and child marriage, but I'm going to avoid duplicating what Dennis has just shared with us. I'm going to talk a little bit more about child marriage trends over time, and also projections for what it will take to end child marriage, to end FGM, sorry, in Kenya, and also talk a little bit about intervention effectiveness and the opportunities and risks that there are for integrated policy and programming. Which I've just covered. So first of all, I thought it might be helpful before diving into the Kenyan context to just situate what's happened in terms of child marriage prevalence globally over the last 20 years. So this graph is actually taken from a report by UNICEF. And you can see really clearly that there has been a clear downward trend in the overall prevalence of child marriage over the last 20 years. And when I say prevalence, we mean the proportion, so the percentage of girls, women, sorry, who are aged 20 to 24 who got married before the age of 18. That's the standard indicator. So this just refers to the proportion. In terms of the absolute numbers, it's possible that this will actually increase due to population growth. So in terms of the overall trends, you can see that although in the world overall, the prevalence has gone down significantly, the biggest changes have actually been driven in South Asia. So you can see that in South Asia, the possibility, the risk of marrying before the age of 18 has declined from about 60% to below 30% today. So huge changes there. There's also been quite big changes in Eastern and Southern Africa, more so than West and Central Africa, which I think Mona also referred to in her presentation. But one thing to bear in mind is that between countries and also even within countries, progress has been strongest among the richest groups, while often the poorest girls have been left behind. And that's a pattern that we see pretty much across the world. So just a quick recap of current prevalence by region. Sub-Saharan Africa as a whole is 34% prevalence, but there is a big difference between East and Southern Africa and West and Central Africa. South Asia around 28% and 36% in the lowest income countries, which is around double the global prevalence, which is 19% today. And then we've seen most stagnation in Latin America and the Caribbean, in the Middle East and North Africa. So as Dennis has said previously, child marriage has declined in Kenya, and actually Kenya's performance has been relatively strong compared to some of the other countries in the region, and definitely compared to some of the countries that are in West and Central Africa. But as Dennis mentioned in his presentation, there are hotspots that remain at the subnational level. So although you can see that the overall prevalence has declined by about a third, from 32% in 1989 to 23% today, and a substantial about a third decline in prevalence of marriage before the age of 15 as well, there still remain hotspots. So as Dennis mentioned, there are specific counties where prevalence remains around the same level as in 1999. So in terms of FGM, similar story, there's been a stronger reduction overall. So from about 38% in 1998 to 21% today. And similarly to child marriage, we see that there remain hotspots at the subnational level. We obviously, in our work, when we're thinking about child marriage, we're thinking about adolescent girls specifically. So this slide, the previous slide, refers to FGM among women aged 15 to 49. But if we want to understand what's happening with the younger girls, it can be helpful to look at the prevalence among girls who are just aged 15 to 19. So you can see from the graph here that the prevalence of FGM among girls in this age group has declined significantly from around 48% in 1974, 1979, to 11% in 2014. So a very substantial drop. However, because we know that quite a lot of the cutting occurs at or after the age of 15, this particular indicator will typically undercount the prevalence, because many of the girls, when they're asked this question, or their families are asked the question of whether they've undergone FGM, they may not have undergone FGM at the time the survey is asking the question, but they may still go on to undergo FGM later. Continuing to look at this indicator, and with that caveat in mind, this slide gives you a sense of where we're going in terms of how can we project where child marriage, where FGM prevalence will be by 2030 if we're looking at trends so far to date. So continuing from the previous slide, you see the trajectory of FGM prevalence in this age group going down significantly to 11% in 2014. And then if you look at the pink line, you see what the prevalence would be in 2030, 2045, and 2050 if progress continues at the same rate that we've seen over the last 30 years. And that would mean that in 2030, the prevalence of FGM among girls in this age group would likely be around 6%. So not on track to meet the SDG target. If that progress was to double, so if it was to be twice as fast, likely the prevalence of FGM among this age group would drop to around 3%. So substantial acceleration is required to meet the SDG target is the key takeaway. So moving on to what will it take? I think one of the key things that emerges from the literature is that not only, as Dennis was saying, do child marriage and FGM in Kenya share very similar drivers, a lot of the approaches that are used to address FGM and child marriage are actually very similar. So very common interventions include things like offering economic support and incentives, community dialogue, engaging different members of different generations, including parents, grandparents, but also community dialogue with traditional and cultural leaders, men and boys. These are all things that are used by child marriage and FGM practitioners. Legal reforms, obviously, empowering girls, so things like life skills programs and supporting girls to build their own agency. Increasing access to quality education, role models, and the use of media and social and behavior change communications. And then you can see that on the right-hand side, there's only a small number of interventions that are only used by one sector or the other. So it seems like there's opportunity to integrate, though that doesn't seem to be happening so much at the moment. So in terms of what are the best approaches, what do we actually know from the global evidence? So the evidence base for child marriage is quite limited, actually, because child marriage wasn't really on the development agenda until about 10 years ago, when Girls Not Brides came into existence. And so for that reason, most of the evidence on child marriage that we have has actually focused more on identifying the problem. So most of the bulk of the research and the evidence and what we know about child marriage is actually related to why does it happen? How common is it? What are the consequences? And where there's the least research is actually around the types of interventions that are most effective. So there's a real lack of evaluated programs. So it's actually quite difficult for us to make a informed assessment of what the best approach is. So there was a recent paper which has made a lot of waves by Andrew Malhotra and Shatta El-Nakib, which was published in 2021. And this paper suggests that probably the most effective interventions for addressing child marriage are economic interventions, so things like cash transfers, social support to parents, and keeping girls in school. However, this paper identified that there is a real lack. There's a lack of evaluated programs anyway, in general, for child marriage. But where there's the biggest lack of data and evidence is actually when it comes to community-based interventions. So it's quite difficult for us to make a judgment about how effective they are. And at Girls Not Brides, we feel that it would not be right to write off this type of intervention because we recognize the fundamental importance of engaging with communities on this issue. So Girls Not Brides, our approach that we advocate for is a comprehensive approach that looks at all of adolescent girls' needs and tries to address them holistically. So not only focusing on schooling or economic or community-based interventions, but really thinking about taking an ecosystem approach, addressing laws and policy, access to education and health services, as well as community engagement and building girls' agency and life skills. In terms of FGM, the evidence base also seems to suggest that there is a lot of value in a comprehensive approach, and that this should also combine community engagement for social norms change. I think that came through very strongly in the discussions and the presentations earlier today. Laws and policies that ban FGM. I think there's debate about whether criminalization is helpful or whether laws which ban it are enough, but I think there is recognition of the value of laws and policies for normative change, use of media for campaigns and behavior change communication, and also working with education and health sectors to help staff become change agents and act within their community. But the bottom line is that for this discussion today, because obviously we're here not to talk about just FGM or just child marriage, we're here to talk about how we can address both of them together effectively. The bottom line is that there's very little evaluation of programs that do address FGM and child marriage together. So we do know that we have members who are doing this, and many of them I think are here today. Girls Not Brides has helped some of our CBOs document the work that they're doing, but we need much more evidence in this area to give us a roadmap for where we should be focusing our efforts. So yeah, I think key takeaway is there's just a lack of examples of evaluated programs that address child marriage and FGM. There's a lack of evaluated community-based initiatives, and there's not much evidence on how large-scale programs are affecting change in either of these areas. One other issue that I'd like to draw attention to is that obviously I think, again, we've all been discussing this morning about the importance of social norm change for behavior change. And social norm change is something that takes a lot of time. And a lot of programs are often designed for 1 or 2 or 3 or 4 years. And that's often just not enough time to change those deeply held beliefs that communities and parents and girls themselves may have, and for that, those beliefs and attitudes to translate into behavior change. So I think that one of the gaps that we have in the evidence and in both sectors as a whole is longer term funding cycles, which would give more of a chance to achieve that real long-term change that we want to see. In terms of opportunity causes and hotspots within Kenya, stuff together, because it's often not always the same girl, but where it is the same girl, it makes sense to try and tackle the issue in an integrated way. Funding opportunities, because donors are increasingly interested in funding work on both issues, because it's efficient to run one program which targets the same girls than to run 2. In terms of risks, as I've gone over, the overall evidence link is quite limited. We need context-specific interventions. And when we think about implementation, I think it's important to recognize that there could be backlash from county political leaders and community elders, because these are both sensitive topics. And we're talking about social norm change. This is related to people's beliefs. And so it could be very ambitious to tackle both issues head on. Another risk, which I think is important to draw attention to, is that these goals are not necessarily interdependent, because you could, for example, reduce FGM without changing child marriage prevalence, because FGM and child marriage are both linked to fears about girls' sexuality. So if you manage to reduce FGM, it could be the case that child marriage increase because there's increased concerns about girls becoming pregnant or having sex before marriage. In terms of what next, some things to consider, girls and breaking down silos. Instead of having multiple programs targeting the same girls, how can we really target the needs of adolescent girls in a holistic way? There's clearly a need for more evidence, and that is across the board, but particularly where the biggest gap is, there's a need for more documentation of the great work that community-based organizations are doing. I think there's a need for some new thinking on impact measurement, particularly when it comes to social norms change programs, and also alongside that about the length of time that those programs are funded and run for. And lastly, I think there's a need, although the evidence base may be limited, to base what we do next and our considerations on what we can learn from the evidence that we do have. So I will stop there, and thank you very much.
Thank you. Thank you, Arwin. Thank you, Arwin. Very thought-provoking presentation there. Ladies and gentlemen, you must agree with me that we've had a marathon session with lots of information, and you might find that there's quite a bit of information that you're trying to internalize. think through it as I give you 20 minutes of some quick interaction. Think through it when Bernadette Loloju, Madam Bernadette, spoke about the mandate of the anti-FGM board and how the government bodies are structured and how they interchange. Think through it when Mona Aika gave us that great table there that is showing us the global partners working on ending FGM and CM. And for me, in my mind, I was wondering, how do I interact with them? How do I get there to work with them? Think through Faith Lanoi's presentation on really what Girls Not Bride Kenya is actually up to and the reach and everything that they have put together so far. Think through it, the provoking presentation by Dennis. That data is extremely important. Like we say, what cannot be counted cannot be accounted for. Are we getting it right with the numbers? Are we monitoring? Are we marking? And now, of course, when Arwin comes down to speak about evidence-based approaches and the trends, the emerging trends, and what ought to be done and how to get there. So I want to open up the plenary now for like 10, 15 minutes. If we can engage, and there's quite a bit of engagement on chat as well, feel free to go on chat. I'm going to open this up to interventions, questions, thoughts, what you have captured, what you have gathered. I hope our team Migori is still set. Migori, are we okay? Can you still get us clearly? Team Migori? Yes. Are we set? Can you get us clearly?
Yes.
Very good. So I'll open the floor to interventions, to questions, to discussions, to thoughts. There has been a lot of thought about breaking silos and getting us to collaborate more, to coordinate more, for example, with the government institutions. If they could only coordinate better, then we were able to get a clear path. There's been a lot of talk about collaboration with CSOs down there on the ground and how we can join together to just make it better. What are your thoughts? Leseketi, Leseketeti, did I get it right? Do you have a question? Feel free to come in here if you want to throw in a question or a thought. Honorable Kilimo, I know you have had quite a beat and you must be thinking through quite a bit of what has been presented. There's a question there. There's a hand up from Migori. Yes, please go ahead.
I think it's like a question or a suggestion.
Mm-hmm.
And I think Chelimo is in. Lina. I think Lina is in, and I want her to clarify this because he's one of the activists who said that government leaders across Africa often say the right things about child marriage and FGM, but have yet to produce the political commitment, resources, and on the ground to help end these harmful practices. So I want her to come very clear because she said that she was in the 9th Parliament. And she even clarified that she enacted a law on FGM. So I want her to tell me, is she in agreement with Dr. Agnes Adhiambo, who said so? Hello?
Your question to Honorable Kilimo is?
It's like a suggestion. I want her to clarify, maybe is she in agreement with what Adhiambo said, that government leaders across Africa often say the right thing about child marriage and FGM, but have yet to produce the political commitment, resources on the ground to help end these harmful practices.
Mm-hmm. Welcome, Honorable Kilimo.
Thank you very much. Hello, can I be heard? Yes. Thank you very much for that question. I see Migori team were really paying attention because it's exactly as he has put. Yes, there is a commitment at the highest level. Let's say now, for example, we were told by Kulea that at AU or AFLA, Organization of African First Ladies Association, it's like their mandate, or they agreed to talk about child marriage. But is it happening? Now, myself in Parliament, I'm grateful that we have political support from the highest office in Kenya, from the presidency, because I moved that law. It was passed in Parliament, but you see, without the president ascending, it can go nowhere. And so the retired President Mwai Kibaki, 2011, ascended that law, the Prohibition of FGM Act, to become law. And as we speak currently, and it was confirmed by the CEO anti-FGM, that our president, the current president, Uhuru Muigai Kenyatta, has committed and has given a declaration that FGM must end by 2022. Now, but there was a rider in my second contribution when I said, currently, why not much is happening, which confirms what you've just said when it comes to commitment or committing resources at the county. Yes, there is the commitment from the national government led by His Excellency the President. And that is why resources are availed to the anti-FGM board, and even just to set it up as a semi-autonomous government agency is a commitment. We have the State Department of Gender that I do oversight the activities of the other sagas here, including anti-FGM board. But now where we have a challenge is at the counties, and I think I did say that at the counties we have the CEC member, yeah, or you can call the minister. And then we have the county assemblies where we have MCAs. Now, when they are making their budgets, they are not allocating resources for campaigns against either FGM or child marriage. And I said also that those are politicians, sometimes issues touching on telling people, don't do this, don't do that, telling them that what they considered normal is not normal as we are now. People fear losing votes. It's not a popular thing. Let us face that. And that is why me and my colleagues in Parliament, who we saw when the doctors did the presentation, they said, let us pass that law banning female genital mutilation. We had gynecologists taking us through the challenges that women go through because of FGM. And then, of course, the educationist, which was basically done by the MPs themselves, like Honorable Kapondi, and I salute him. When we talked about the effects of FGM on education, he actually said, wow, he now realizes why there were no ladies who have finished secondary level education in some part of his constituency where FGM was very, very prevalent. So, even you at Migori, I'm sure your member of parliament or member of county assembly finds it a challenge to talk about FGM for fear of losing votes or child marriage. This is where the challenge is. The policies are there, but now to continue driving those policies in the grassroots is where the challenge is. And I did say that the best part would be to have the communities churning for change. And that can only happen when we have active civil society organizations, when we have the active youth who are able to read. And we know we have got many educated youth at the moment who can actually influence each other peer to peer. And I also talked about exchange programs to know what's happening beyond the boundaries of their communities, that they're the ones to make the decision and tell their parents, it is not possible this way. And even if some have undergone, they will be careful now to protect their siblings after them, not to pass through what they went through because of education. While, Dr. Matanda had just spoken about levels of education and the perpetuation of this child marriage and FGM, where a mother is educated, they are likely to understand the consequences of FGM when they are told and protect their daughters from undergoing what they went through. So unlike on the other side, so for one who has not undergone. So if we have the CBOs or CSOs in these communities, training them and demanding during public participation, we now have public participation in our country, that they are able to raise up and say, this is what we want. We want resources allocated to the gender department of the county to hold forums, community dialogues on ABCD. It is not there. I'm now in the State Department of Gender, and when you talk to the gender officers on the ground, there's little funding from the national because most of the money has gone to what do you call them, counties. But now when you go to counties, MCAs, they cannot vote money. They're just voting for the brick and mortar of the country. Yeah, they're just either roads, because when you allocate money for roads, you will get your own contractor who will give you a kickback. When you say you want to build, you like others are just busy buying, either they are just buying buses, even where students cannot reach 54 secondary schools. Why? Because of the monetary kickback they get from there. Or even if not any kickback, even if it's not there, something that people can see and say, yes, you have built this for us. But now when it comes to software, and I consider human beings software of the country, where you are talking to people to change their mindset.
Yeah.
People don't allocate money to that because it's not seen.
Because I know
yet we need money to hold such for.
Yes. Honorable Kilimo, I know more questions are coming for you, and we are looking at the time. It's a bit
Hello,
short.
I can't hear. Yes?
Can you hear me now? Can you hear me? There are more questions coming for you.
Okay.
Honorable Kilimo.
Yes, I can hear you.
I appreciate the reality that you're bringing on the table about the reality as it is. Leseketeti has a question and Esmail has a question. Leseketeti, please ask your question and then Esmail will follow. Esmail Omar.
Okay, thank you so much. Mine is not a question, it's just a point of concern.
Yeah.
And particularly on the issue that was being addressed by some of the panelists in the group, like our leaders need to be capacity built and advocated for the essentials of saying no to these retrogressive cultures. To my opinion, so we need to, like, if there's entities that are advocating for, let's say, advocacy on inclusion for the MCAs to be included in the process of eliminating female genital mutilation, it is very basic. Because some of them, even when you go to some counties, we have MCAs who are dragging some communities behind. We need them to be advocated on the importance of passing anti-FGM laws in their county assemblies. Yes. And I think the Anti-FGM Act needs to be absorbed by all county governments, so that at least when they are budgeting.
Yes, Black.
Yes.
Yes.
Thank you. I got your point, Leseketeti, that the MCAs need to be educated on FGM in passing through these laws and policies. I take it. Thank you. Ismail, can I have you come in?
Labs. Please, I'm really interacting.
Ismail and then Evelyn Presh.
Yes, yeah, thank you. I thank you so much for the organizers of this event. I think it's a very important event. And thanks also for Dr. Lina Kilimo for her insights. So mine is not a question, it's just to raise an issue, because I've been part of this process at a national level, in terms of how best do we address child marriage as a country, because there has been so many interests, because there's an intersection with FGM, and that's where anti-FGM board comes in. But the mandate of ending child marriage, I think it is within the Department of Children Services, because, and also again, because it's a gender issue, the Ministry of the Gender Affairs also comes in. And so you find that this issue has been like being thrown around in the different government departments. And I guess that lack of coordination is what has seen us until today, we do not have a national plan of action to end child marriage as a country. And even after Kenya signed the AU commitment, the AU campaign on ending FGM, we have not been able to move forward. So I guess maybe from Lina Jebi Kilimo, it would be great to see, or to have a high-level forum to discuss the best way to handle this issue. And if we can have a sort of a multi-sectoral intervention across the relevant government units, that would provide a very great way forward. And also, how can we harness the already existing county level systems like the anti-FGM steering committee, the gender technical working groups? How can we be able to harness and leverage on those particular structures to be able to end end child marriage at the county level? So let me stop at that. Yeah.
Thank you, Ishmael. I'm rushing through. There's quite a bit of interaction on the chat as well. Evelyn Presh, as you stand by, I'll quickly read a question from Helen Gadongo. You had asked Dennis, Dr. Matanda, you are interested in knowing the method used in data collection. And Dennis says the Kenya Demographic and Health Surveys are cross-sectional surveys that are conducted after 5 years or more, where women are asked to self-report about their FGMC status or experiences related to child marriage. You can Google the report, it is online. Grace Gitao says, great presentations, Pop Council and GNB right there. Numbers do not lie. We have achieved great milestones. I concur with the presenters that focused acceleration is needed to achieve the SDG target. Teresa Jeffita, you say, I appreciate the opportunity to listen to the conversation today. And my question is, how can we widen the advocacy on the effects of FGM? Because I feel most communities still do not have the facts at hand. And that is why we will always hear this every day. Okay, well, more coming in. I will read some more. Migori, you still have 3 questions, but let me quickly jump to Evelyn Presh. Evelyn, you had something to say before I go to my panel. And don't worry, we'll try and fix in everybody so that we can fit. Evelyn, what did you want to say? You're welcome. And I absolutely love your jewelry on your neck and your head. Karibu, Evelyn.
Thank you so much. My name is Evelyn, as you said, from West Pokot County. I'm really privileged to be here today. On the issues of child marriage, I know during the time of the pandemic, issues or cases of child marriage has really gone up. And as a team, I think we are not prepared because we didn't know that the pandemic is going to come in. I don't know whether because we need to deal with the child marriage by 2030, I don't know which measures do we have in place so that we can be able to curb increase, especially during the times of pandemic. At the moment, there are so many, like Mheshimiwa Kilimo said, as I am a grassroots campaigner on against child marriage. Now the community is telling you, due to poverty, we don't have anywhere to take the girl. So I don't know whether we have any emergency response for these girls affected by child marriage, because some of them want to go back to school, some of them want to run away from this early marriage. And I think we need to support them. Thank you so much. Thank you for allowing my jewelry as well. Thank you.
Yes, thank you, Evelyn. Very important questions there, especially now during the pandemic. And at this juncture, I'm going to call my 3 panelists. I understand, I don't know whether Dennis Matanda is still there, but I would like to call upon my 3 panelists. That is Dennis Matanda from Pop Council. I would like to call upon Masharia Karanja, Youth Anti-FGM Network. I would like to call upon George Dungu of World Vision and Caroline Lagat of Equality Now. Lovely to see you here, Caroline. Very quickly in this session, we are going to discuss what is working well, and that will answer your question, I believe it will answer your question, Evelyn, because then we really want to know from the panelists whether they can share learning experiences. What would you say are the critical success factors for their approaches in their work? And then what challenges do they face? Do we have the panelists ready? Do we have the panelists ready? If you can help me with that in Total News. We have Dennis Matanda. We have Masharia Karanja. We have George Ndongo of World Vision and Caroline Lagat of Equality Now. What has been working well? We have to understand the justice sector intervention, multi-sectoral programming, child protection. What has been working well? Any of the panelists can take this up. Is Dennis still there? Any of the panelists can take up this first question. If they can just respond to this question, what are the critical success factors for their approaches? What has helped them succeed in their approaches? Caroline?
Hello.
Yes, please. Caroline Lagat, please coming in.
Yes. So what I'm speaking from the justice sector.
Yes.
And with the justice sector, we work with the court users committee primarily, and of course, CSOs are involved, are included in
Caroline,
the.
Can't see,
Sorry.
See your forehead. Are you able to change
Oh,
the?
okay. Sorry. Is it
there?
better?
That's better. That's great. Thank you,
Okay.
Caroline.
Sorry for that. So in the justice sector, we've mostly been working with the court users committee in the different counties that we implement our activities. And of course, CSOs are part of the court users committee. So if you know how the court users committee work or their composition, you would know that there is the multi-sectoral approach being applied by the court users committee. And
sorry to interrupt.
hello?
Just to clarify, in terms of the presenters, we have Beth Kangwana from Pop Council, and we also need Viola Ruto from AMREF.
Thank you, Nolene. Beth Kangwana from Pop Council and Viola Ruto. Thank you very much. Just proceed, Caroline.
Sorry, I'm facing a bit of a challenge putting on my video. If you could allow me to just finish this point, and then I'll try to fix it in the next session.
That's okay. Go ahead, Caroline.
Of the court users committee work, there's multi-sectoral approach being applied, and there's also a lot of collaboration because the magistrates are involved. We have the prosecutors, we have children's officers, we have gender officers, we have probation officers, and we also have police officers, and also CSOs and religious leaders, chiefs. Everyone is involved. So that has been critical in the work that we do with the justice sector to ensure that they understand the issues that concern child marriage and also FGM. And then I would also add that there was a lot of collaboration amongst CSOs when the case of Dr. Tatu Kamau versus the Attorney General and the anti-FGM board and the ODPP was taking place. So the CSOs who are interested parties in this case would meet regularly to go through their points and to refine it to make sure that no point was missed and to enrich the judgment that eventually came from the Constitutional Court. And then something else that has been working for us is the peer-to-peer learning and feedback. within the court users committee. So we've been doing training of the court users committee, and within the training, we don't bring just external people to come and do the training. We ensure that the trainers within, the prosecutor, can you please give a presentation on evidence? How is it presented in court? What kind of evidence do you need for FGM and child marriage? The police, how do you investigate? How is the P3 form filled? Medical examiners and medical practitioners, how do you fill the PRC form? How should it look like? What kind of information is required? And then the magistrate also gives the point of view of evidence, presentation and preservation, you know. So because we've noticed that in access to justice for survivors of SGBV in general, including FGM and child marriage, it fails in the justice system when it comes to evidence. So if it's not taken care of properly, then it will continue to be a challenge, and it means that prosecution will not happen, and we will not get fostering the peer-to-peer learning and feedback session. And also within the same environment, they all critique each other. So what kind of challenges do the police face when they're working with the medical examiners? For example, this came up in one of the sessions, is that when police officers are taking children of defilement, they're asked by the medical examiners to collect the evidence themselves. And they're told, okay, go to the toilet, then tell the child to chuchuma so that you can collect the evidence, which is not the correct way of collecting evidence for defilement from children. And then something else, not only children, but also survivors of sexual violence. That is not correct at all. So from that session, there was a lot of learning, critiquing, and lessons that were taken on board from every single sector within the justice chain. And then another one is that we've been amplifying survivor voices, giving survivors the opportunity to speak about the challenges they have in accessing justice. For example, we had a session with the Kenya Magistrates and Judges Association, where survivors were talking about how they have not been involved in the bail and bond hearing session, because they should be involved before the perpetrator or the accused can be given bail and bond. So is that likelihood that they would abscond or they would intimidate the victim or the witnesses? So some of them talked about the challenges of them not being involved and how it affected their case later on, because for some of them, until now, years on, they have not been able to access justice. And finally, what we found to work is not dictating the agenda to partners. So we work with what the court users committee already have. Most of them have work plans. They know exactly what they want to achieve the goal that they have in mind in terms of access to justice to everyone. So for example, the court users committee in Kwale had done had gaps are together to create a curriculum for the training that would serve would fill the gaps that they had already observed. So we didn't go in and start dictating what they should do. So because it's a collaboration and it's a partnership, there is no hierarchy in there. It's collaboration and working together. Thank you, Mildred.
Right. Thank you very much, Caroline Lagat. You know, of course, we affirm and appreciate the work that Equality Now does on these issues. Dr. Beth Kangwana, with apologies, with a mix-up, welcoming you now. And I think Dr. Beth Kangwana from Pop Council, and you are going to capture very quickly a bit on the multi-sectoral programming. Welcome, Dr. Beth. I don't know whether you're sharing a presentation.
There was a presentation which I had shared with Nolene, but I can very briefly talk through it if our time is limited.
Okay, Mtoto News, are we able to quickly get Dr. Beth's presentation, or should she talk through it? Okay, I think we can go ahead, Dr. Beth, and maybe you can just capture those points for us.
Yeah, so I'll just briefly talk about an intervention which we've been working on at Population Council. It's called the Adolescent Girls Initiative. It's a multi-sectoral approach that we implemented in Wajir County with the main aim of trying to reduce child marriage. We were only looking at child marriage. So the intervention, okay, there you go.
There we go.
Yeah, thanks. So just maybe on slide 2. Yeah, so the intervention was really asking what package of multi-sectoral, multi-level interventions had an impact on adolescent girls, and also if we were able to intervene early on when the girls are young, what are the long-term outcomes? And when we talk about multi-level, we're trying to intervene at the community level, the household level, and also at the girl level. Next slide. So just very briefly, this was the theory of change. So the thinking was that if we are able to intervene in early adolescence and provide girls with 3 main components, so wealth creation, so provide them with financial literacy and savings, intervene at the health level, so provide them with safe spaces where they can discuss sexual and reproductive health issues and life skills. And then also provide them with education. So at the household level, provide conditional cash transfers, conditioned on the girl going to school. And we were also targeting at the household level violence through violence prevention initiative, where we had community dialogues to discuss the value of girls and how that the perception of what the value of girls are in the community can be improved. So the thinking is, if we could provide that to girls in the community where the girls are young, when the girls then transition to early and mid-adolescence, will this then translate into different assets for the girls? So economic assets, like for them having financial goals, social assets, so having more positive gender norms, health assets, so knowing more about sexual and reproductive health, nutrition, and also educational assets. And also at the community level, changing the norms to have more positive norms on the value of girls. And then if we were able to instill this in girls early and mid adolescence, then later on, as the girls then progress to mid and late adolescence, will this then translate specifically in Wajir to delay age of marriage, the age at which girls in Wajir get married, and then also will it delay childbearing? And at the community level, will it reduce experience of sexual and gender-based violence? So that was the theory of change. Next slide, please. So it was a cluster randomized control trial. We had 4 different arms where we gave a certain group of girls just community engagement, so violence prevention. Then for another group of girls, we added on the cash transfer component for the second arm. Then for the third arm, we added on health and life skills as an additional component. And then for the last arm, we added on financial educations and savings. So girls who were in arm 4 received all the different components. And we wanted to compare and contrast and see what the differences are across the different arms. Next slide. So just specifically in Wajir, this was also carried out in Kibera, but in Wajir, the main issue here was child marriage. We had around 3,400 girls. We started off with that baseline, 11 to 14 years, and we worked across 80 different clusters or villages. We carried out a baseline survey in 2015, and then soon after we implemented the intervention, which ran from 2015 to 2017. And then 2017, we came and collected data as a midline. And then 2 years later, we came back at endline in 2019 to see if any effects we saw at midline were carried on 2 years after the intervention had ended. Next slide. So by midline, what we were seeing is we saw significant improvements. So girls who received the full, all the 4 different components of the intervention, we saw significant improvements in primary school enrollment, literacy and numeracy. Girls had more positive gender norms and self-efficacy. And we also saw significant improvements in financial literacy and savings. And what's key is that we saw that girls who participated in the empowerment program, so the safe spaces, tended to have stronger educational outcomes than girls who did not participate in the safe spaces. Next slide, please. So we came back 2 years after the intervention had ended, and we wanted to see, okay, so what does this mean in terms of child marriage and education? Next slide, please. So in this graph, this was in 2019, just so that you can understand the graph better. The green bar is the control, so girls who were only receiving the violence prevention component. And the blue bar is girls who were receiving all the different, all the 4 components of the intervention, so the full multi-sectoral approach. What we saw is that when you looked at the percentage currently enrolled in school, girls in the, there was a huge increase of 30 percentage points in girls being enrolled in school for those girls who received the full package of the intervention. When it came to percentage ever married, we saw that when compared to the control group, girls who received all the 4 components had a significant, were 20 percentage points less likely to be married. So marriage in the control was 50% compared to 30% in the intervention arms. And then for those who were ever pregnant, we saw in the control, marriage was up at, ever pregnant was up at 34%, and had significantly decreased to 17%. So a drop of 20 percentage points. So we saw significant improvements in school enrollment, a decrease in child marriage, and ever being pregnant. Next slide, please. So just what the take-home messages are, what we saw is working across the different sectors, having a more multi-sectoral approach, had better effects than just working with one intervention component. We also saw that addressing underlying economic constraints at the household level, so the cash transfers, which encouraged girls to go into school, really opened up change for the girls and had allowed the girls to have better outcomes in education and also in reducing child marriage. Next slide, please. So any further information, this was very rushed, but you can go and look at the full report at the Population Council website. Thank you.
Thank you very much, Dr. Kangwana. As I'm going through your presentation, I'm just asking myself, how do we unpack that to the simplicity of internalization on the ground? Because it is such important data, very important. But the question in my mind is, how do we unpack it and break it down to a level that can be easily palatable, if I may use that word? But thank you, that's extremely important. I want to call on, before I open the plenary now, I would like to call on Viola. Viola, are you there? And then I will come back to plenary. We have like less than 10 minutes before we break for lunch. But Viola, if you're there, yes. Did you have a presentation? Yes, Viola.
This is Viola.
Please come in. Yes.
I will not project my presentation. I don't have a presentation. I would say I have stories to share, and it's about engagement with the Samburu Top Clan elders, a journey towards ending FGM and child marriage. First of all, I'd like to recognize the partnership that made the engagement with Samburu Top Clan elders a success. The Anti-FGM Board, national county government, relevant departments, local administrators, civil society, and the community champions. So for us, this declaration would not have been achieved without the key players coming in. So it was a multi-sectoral approach. So AMREF participated in this journey through its flagship project. It was called Cohota Injena, Come Let's Talk, founded on the dialogue approach and funded by USAID. The Cohota Injena project was in 4 sites, 3 sites in Marsabit County, that is Wainsololo, targeting the Borana. Then we were also in Makona targeting the Gabra, and in Karbi targeting the Rendile, and in Wamba targeting the Samburu community. And I will focus my presentation on the Samburu top clan elders. The focus was to engage clans and clan leaders to address gender inequitable norms that are supportive of child marriage, FGM, and the low value of the campaign. The campaign to eliminate FGM has been going on for many years, but has been intensified in the last 10 years through both engagement of women and girls. And so quota and gender invasion to shift the conversation to include the men and the male youth. Let's say the elders and the male youth also in the conversation of ending FGM and child marriage. The project was launched in 2018, and immediately after, we conducted a clan mapping exercise to explore the community's leadership and decision-making structures, particularly regarding to the abandonment of FGM, child early marriage, and promoting the value of the girl. Clan mapping found that there is a leadership hierarchy. We have the lower clan elders, the middle clan elders, and the top clan elders. And the top clan elders are the ultimate decision makers in the community. At first, we focus our attention in conducting dialogues between the lower and the middle clan elders and the youth, who were able to take us to the top clan elders. At the same time, we also empowered community champions. And the top clan elders needed to be targeted to accelerate efforts towards abandonment of harmful cultural practices through public denouncement of the practices. The dialogue approach was chosen as a culturally acceptable and appropriate way of engagement that conditions elders to favorably listen to its own community testimonies and be open about reevaluating their norms and attitudes on the harmful practices. It was an acceptable approach by the elders since it was not forceful and it was respectful and it was listening to them, giving their views on the harmful cultural practices. However, at the same time, we were conducting continuous education on the negative effects of FGM, child marriage, and their legal frameworks, and demystifying the myths. So empowering champions to lead change with their clan proved to be highly effective in convincing clan elders to start questioning the harmful cultural practices. Several meetings were held with the top clan elders. In the initial meetings, women were not included in the conversation. However, through requests to them during the dialogues, the elders accepted to include them in meetings. Women sharing their personal stories in the conversations contributed to the norm change. The Kisima Declaration to end FGM and child early marriage was achieved through a gradual, progressive, and respectful engagement. Initial meetings were carried out in a place called Mount Nero region, where the majority of the top clan elders reside. Obtainment of child marriage and promotion of the value of the girl through taking girls to school was much easier to achieve. Actually, the project started in 2018, and by the end of 2019, the elders had given us an approval, and they had conducted a public declaration for ending child marriage and the promotion of the value of the girl. While at that point, they were holding off commitment for abandonment of FGM, citing deep-rooted cultural values to it. They were holding it off, but at the same time, they were ready to continue listening to the dialogues, and they were ready to continue being engaged through the dialogues conversation. At the same time, the Mount Nero top clan elders, when they had decided themselves that it was time to actually end FGM in the Samburu community through public declaration, they said we needed to build consensus within the region. So they guided the anti-FGM board, AMREF, World Vision, with the involvement of relevant national county departments to target other Samburu top clan elders across Samburu County and others in Marsabit County to build the consensus for abandonment of FGM. The team engaged elders from the targeted region separately and later brought them together to Mount Nero to lead to an agreement for the public declaration to end FGM. All the meetings were successfully conducted and the elders were in agreement that a time to call an end to FGM had reached, and hence, which led to the Kisima Declaration that was presided over by His Excellency, the President of this nation. I would like to pick a few quotes from the elders as we went around, and unfortunately, I cannot pick many. I just picked 3. So one of them was, and they are very powerful quotes to me. So one of the elders was said, listen to what I am saying. Elders from all the mountains, listen to what has been declared at Tandem Shed. It has been declared that no early forced marriage to any child who has not attained the 18 years of age. In the past, there were indicators that could weigh if the girl is ready for marriage, such as ability to load a donkey. A girl be old enough to be able to conduct home chores comfortably. We cannot allow any girl to be married before 18 years. I hope you have listened. We have given another one. We have given boy and girl equal opportunity in education. We will take both to school because any child that you have not taken to school will live to be poor. All children should be taken to school in order to be able to help themselves through education because a girl child is equal to a boy child. Since all of them are my children, we cannot love them differently. We wish them they grow equally. On FGM, there is no problem. That is another quote. There is no problem to uncircumcised girl because God created her perfectly. Those are just some of the quotes from the dialogues that were conducted. We attest that to achieve lasting cultural and norm change in the eradication of FGM and child marriage, the process must first and foremost come and be led by the communities themselves. That means getting down to the grassroots levels, conducting dialogues, and getting community voices be heard. Thank you.
Oh, thank you. Thank you, Viola Ruto. Thank you. That really gets me thinking that we really needed to have more room for storytelling, but for storytelling that captures those successes and what has worked. We totally appreciate sharing that bit. Now, ladies and gentlemen, I beg your indulgence. Our time is not what we expected. We are already at 1:30. It's 1:27. We are already at 1:30. We need to quickly break for lunch. But even before we do that, there are 2 presentations by 2 gentlemen who I'm going to request that we will take up immediately after lunch. Presentations by Macharia Karanja of Youth Anti-FGM Network Kenya and by George Ndungu, who's going to talk about including religious leaders of George Ndungu of World Vision. With your permission, and with the permission of the team, please, you can put on your camera so I can see whether you're smiling or frowning at my adjustment of this schedule. You can put on your cameras. Please smile with me because it means that we are not able to beat time. We have a lot to discuss and these issues are extremely important. So Macharia and George Dirango, if you will allow us, that as soon as we get back from lunch, although we actually have quite a bit of interactions in our group discussions after lunch, and I can see there are still hands that are up. Migori, are you still with us? Okay, so I can see we are still having hands up. I urge that we push those 2 presentations immediately after lunch. We will take 20 minutes after lunch. We will discuss a little bit and then we will break to the groups. Are we in agreement? Wave at me if you're agreeing with me. I know I'm safe in my house. I'm far away from you, so you can't hit me, but wave at me. I want to thank you so much for this first day, first session, powerful, invigorating sessions of these important discussions. We are going to break for lunch. Nolene is the one who's controlling my time, and she tells me she's giving us 40 minutes. Am I right, Nolene? 40 minutes, that we are back here at 10 minutes past 2. Am I right, Nolene? Nolene, I don't think she's very happy, but let's just make a note that we will come back then at 9 minutes past 2. Is that okay? Nolene, are we okay with 10 minutes past 2? Are we okay with 10 past 2? Okay, I take it as a yes, Nolene. I see you there. I take it, just wave at me if you're okay with it. I see you, Nolene. I think the transmission, oh, thank you. So ladies and gentlemen, take a break. Let us have a short break of 40 minutes and come right back. Things are getting hotter. We need to get through this discussion and get somewhere. So thank you very much. A clap to all of you. Thank you very much. 10 minutes past 2. We'll be right back.
Like so many people in the world, I knew what child marriage is, but not much more. But then I started looking a bit into the issue, and I had no clue how enormously big this problem is.
Child marriage violates her rights to a life free of violence and a life of choice. It deprives her of her childhood. By addressing child marriage, we are protecting